Okay, let's go right to Ontario for the update.
We're working around the clock to clear the backlog of surgeries. And as a part of COVID-19 fall preparedness plan, we're investing over $741 million to accelerate efforts to reduce surgery backlogs. That's over $283 million to support more priority surgeries for patients. For cancer, heart disease, cataracts, tumors, spine injuries, and many other procedures. This will also help us extend hours for MRIs, CT scans, and other diagnostic services that will allow us to perform over 50,000 more surgeries and up to 184,000 more MRI and CT scans. And we are also adding over 1,400 more beds and care spaces for surgeries. We know every additional hospital bed we secure puts us in a stronger position to fight the next surge. Every hospital bed we free up, it can make all the difference in the world. That's why we're investing over $457 million to build our surge capacity in our hospitals across Ontario and expand care in communities and in homes to reduce pressures on our hospitals. We're helping 20,000 more seniors and patients transition from hospital beds to long-term care, home care, and alternative care. We're investing $100 million to deliver 484,000 more home care visits. This one stat just amazes me. That's 484,000 more home care visits. And this is an amazing number. And 1.4 million more hours of care from personal support workers and the PSWs. I love you guys. You're absolutely amazing. All of these measures taken together will ensure our hospitals have the capacity to care for COVID-19 patients. It will help us reduce the surgery backlog while still ensuring all patients receive the care they need. And earlier today, we announced further restrictions to stop the spread of COVID-19. Effective today at midnight, all bars and restaurants will be only permitted to remain open until midnight. All adult entertainment clubs will be closed right across the province. All businesses and organizations will be required to implement screening procedures for their workers. And tomorrow, going forward, restaurant and bars must stop serving alcohol at 11 p.m. and close their establishments by midnight, except takeout service or delivery. I just want to repeat that again. Tonight, they close at 12 o'clock midnight. Tomorrow, they stop serving alcohol at 11 p.m. and close their doors at midnight. Lastly, I'm also pleased to announce that next week, this is the great pharmacies, and I got to give a shout out to shoppers, up to 18 more pharmacies in southwestern Ontario and Niagara region will begin offering testing as early as this Tuesday, including locations in St. Catharines, Niagara Falls, London, Windsor, Sarnia, Brightsgrove, a suburb of Sarnia, Kitchener-Waterloo, Cambridge, Brantford, Chatham, Stratford, Woodstock, and St. Thomas. And we're going to keep expanding to more pharmacies across the province in the coming weeks. But the biggest thing we can all do is to make sure surgeries are not delayed, to make sure we have enough hospital beds. It's to follow the public health measures, wash your hands, practice physical distancing, wear a mask, and please get a flu shot. It's these simple things that can save lives, and it's up to all of us to do our part. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Well, there's no doubt we are living in unprecedented times. The COVID-19 outbreak in Ontario meant that we had to take extraordinary measures to keep the people of Ontario safe. That included having to put important medical procedures on hold to ensure the safety and well-being of all patients within our hospitals. We know how stressful this has been for patients and their loved ones, which is why our government is working very hard to create the capacity needed to address the backlog so that patients can get the care that they need. That's why we're investing over $283 million to reduce health service backlogs and over $457 million to expand access to care as part of our plan to ensure that we are ready for ongoing waves of COVID-19. To safely reduce the backlog for health services, this investment will support additional volumes of priority surgeries like cancer, cardiac, cataract, and orthopedic procedures. We're also extending diagnostic imaging hours at healthcare facilities for MRIs, CT scans, and other critical procedures. In addition, we are adding an additional 139 critical care beds and more than 1,300 additional patient spaces in hospitals and alternate health facilities across the province to support increased surgical activity. And as part of our plan, we'll be initiating a centralized wait list and a program to optimize the use of the operating rooms and improve the use of existing resources. This program will help improve the efficiency of our existing resources and increase the number of surgical procedures in our hospitals. To ensure that the health system is prepared to respond to any surges of COVID-19 without interrupting routine health services, Ontario is investing nearly $500 million to increase community capacity. This also means that more patients can receive the care that they need closer to home or in their homes. This includes investments in home and community care to help reduce pressure on hospitals and expanding digital and virtual healthcare services. Our government continues to work to keep hospital and alternate level of care capacity available for patients by increasing the availability of home care, more home care for patients, by increasing access to mental health and addiction supports across the province, and by optimizing the delivery of virtual care. We are working directly with our healthcare partners to ensure our health system is ready to respond to the challenges that we face with future waves of COVID-19. And we remain so thankful to our brave frontline healthcare heroes who continue to act in the best interest of their patients day after day. But over the past 5 weeks, we have seen an increase in the daily rate of new COVID-19 symptoms. We need to take steps now to protect Ontarians and to help our frontline healthcare workers to continue to do the excellent job that they're doing. Earlier today, our government announced additional public health measures to reduce the risk of transmission and to prevent future outbreaks, including additional measures for restaurants, bars, and other businesses serving food and drink. These measures also include the closure of all adult entertainment clubs, and by that we mean strip clubs, and require businesses to comply with any advice, recommendations, and instructions issued by the Office of the Chief Medical Officer of Health on screening individuals who wish to enter their businesses. These measures are designed to address the rapid increase in community transmission in order to keep schools, post-secondary institutions, and businesses open, and of course, to protect our most vulnerable residents. Together, we will continue to work to protect the health and well-being of all Ontarians. That is our top priority. Thank you.